Ma'am, please start.
Hello, good evening to all. On behalf of Maharashtra Adolescent Health Academy, first we are just going to pray for the soul who departed just on 22nd of April at Pahalgam. Maharashtra Adolescent Health Academy strongly condemns the heinous terrorist attack that occurred on 22nd March at Pahalgam, Kashmir. We express our deepest condolence to the families of the victims and stand in solidarity with all those affected by this tragedy. Let's keep 1 minute silence as a tribute to the departed soul. Now I welcome on behalf of Maharashtra Adolescent Health Academy. After the installation, this is our first webinar and the subject we have chosen is teenage pregnancy. We will just request Dr. Vasant Khalatkar sir, who is our Central IP President, to just give us blessings and a few words regarding this teenage pregnancy. And so we can proceed.
Yeah. Good evening. Thank you, Sangeeta, for prioritizing me.
Good evening, sir.
Actually, Sanjay, just I will take 1 minute only. So I am at Delhi. Actually, World Health Summit is going on, and there was the good discussion on this today's subject. Adolescent Health Academy is taking. I think it's a very benign issue, and we have to take it in consideration very much. And really, it's one of the I will say, risk-taking behavior of adolescents. That's going to culminate in all these teenage pregnancy. But we are the person who can stop, who can make the awareness. It's in our hand. Definitely, we have to treat the parents as well as students also. That's why we are working on joint social forum for sexuality education to be started in school. That we are after government that they should. There is a forum has formed, and I definitely need the help of Adolescent Health Academy. Definitely, Maharashtra is in a forefront, and now again 2 more projects are coming for Adolescent Health Academy. You have to work hard for that. If you wish, you will get a lot of work for that. And again, I wish you all the best. Thank you, Shailaja madam, and thank you all the speakers. Thank बोलना ही पड़ेगा because Pragati is there. So I have to say thank to all the speakers.
Thank you, sir.
Thank you,
Thanks a
Shailaja
lot.
madam. Actually,
Thank you, sir. Thank you and good
I'm
evening.
having one panel. Thank you, madam. Thank you.
Thank you,
sir. Thank
Vasantji.
Thanks a lot, sir.
Thank you, Vasantji.
Hi.
Please
Thank
tell
you,
about our
Sir,
वे
thank
victim के
Thank
बारे
you,
में
sir, for
बोलिएगा.
your inspiring word. Now I
आज
request
नहीं
our
नहीं आज संगीता मैडम आज हिमा बिंदु मैडम का भी नाम निकला था व्हाट्सएप प्रोजेक्ट वी आर गोइंग ना
Yes, sir.
that is not possible without you people. That's why.
Thank you
Right?
so much for supporting.
yes,
Thank
sir.
you. Thank you. Bye bye.
Thank you, sir, for your inspiring word. Now I request our President-elect of Central IP, Dr. Neela Mohan Madam, to just give us blessings for this first webinar of Maharashtra Adolescent Health Academy.
Yeah, thank you so much. I was in the Academic Institute program. We just finished. So couple of minutes I joined late and I missed your initial thing. But all that I can say is I wish you all great luck, and with stalwarts like you all on this podium, I mean, it is like they say na Bhagwan Bachai, that there is no way you can be not successful with 3 dynamic ladies, around it. I'm so proud of Shelja. I'm so proud of Sangeeta. And so proud of Hima Bindu. God bless you all with more power, more energy, and to continue with the lovely work you all are doing and benefiting the society, which is more than 50% now adolescent issues that you need to tackle. And these projects are more and more to come. When you talk to any government agencies, we are talking about this thing. And tomorrow, I will also be in that mandapam where I got an invitation on my individual capacity. God is kind, and IIP did a program with UNICEF today, trying to see what we can do to achieve the SDG goals. And tomorrow, I am trying to talk on the issues related to communication, and I think that's extremely important as we progress to understand the role of communication in our life with everyone and our patients and families, etc. Thank you so much, Sangeeta.
Yeah.
Thank
Thank
you,
you, sir,
Dr.
for your
Neelam.
word.
Thanks a lot for joining from your position. Thank you.
You, dear. Thank you.
Thanks a lot.
Never say no to Shailaja.
Thank you so much. God bless.
Okay.
Now I request our today's guest of honor, Dr. Sanjay Pakmode, sir, who is President of Maharashtra IP. Sir, few words for the blessings.
Yeah. Good evening, all. Good evening, respected Vasant sir, President-elect Neelam Mohan Madam, then CIP Chairperson, Adolescent Chapter, Dr. Hema Bindu Singh Madam, immediate past Chairperson, Dr. Kotwal sir, and Chairperson-elect, Dr. Chitra Kulkarni Madam, Secretary, Dr. Sangeeta Lodha Madam, Treasurer Sulbha Pawar, and MAHAAHA Dr. Ms. Chairperson, Dr. Shailaja Mani Ma'am, and all the attendees. Really, it's a very, and not to mention the First Lady, Dr. Mrs. Pragati Kalatkar. It's an eye-opener, teenage pregnancy.
Sir, I think you have joined two gadgets.
No, madam, one.
No, somebody
Somebody-
else
Somebody had
has
joined,
joined
I think.
with two devices.
I had
Please
joined
switch
with the
off one
one only
device.
because I don't have a net. So this
Now
is
it is
really a
clear.
very eye-opener thing. Means really in the modern days, teenage pregnancy, a topic which everybody don't wants to keep a shut on that topic, don't want to open, don't want to speak. But when this topic is kept for the particular webinar, now we are going to hear from all the experts, and all the three experts are from the very three different field. The one person is the adolescent pediatrician who is dealing with the problem. The another is the gynecologist who is means again dealing with the problem from this different angle, and the another a representative of that community where we are going to face the teenage pregnancy, because teenage pregnancy, it, there are n number of negative consequences as we think about the health, education, and the livelihood of both the mother as well as the child. Now, pregnant teens are more likely to experience some complications during the pregnancy, which may lead to so many things. At the same time, the baby is also going to experience so many things after the birth. So both are the sufferers. Now, today, our three experts are going to take us to this topic in a very in the very they are going to tell us how to deal with this particular issue, and I think this is going to enlighten us, and this is going to help us in dealing if something comes like in our office practice. Thank you all.
Yeah, thank you, sir, for your kind words. Now I request Dr. Geeta Patil, past chairperson of Adolescent Health Academy, Central Adolescent Health Academy.
Thank you, Dr. Sangeeta. Hope I am audible.
Yes,
My
ma'am.
internet is little problem. So I totally agree with Dr. Neelam Mohan Madam when there is a combination of Dr. Sangeeta Madam, Dr. Shailaja and whole team. Just now, everyone is telling the same thing. And we have got a blessing from our IIP President-elect, all IIP team and AHA team, and here Pragati Madam is also there. And we know that this topic is so important because we know the percentage, at least what I know is a 6.8% is as much as any other problems what we are facing. And maybe which area it is more, I think it will be enlightened by all the experts. And maybe there are many social reasons, literacy reason, economic reason, gender inequality, social norms, and what are the health risks of that. All these things are very important for us. So let us listen to all the experts who are going to talk today. And thank you very much for giving me opportunity. And I'm seeing so many familiar faces from AHA, and very nice to see Ninisha Chumbole. What's her name?
Chumbale.
Ninisha
Chumbale.
Chumbale. I think She is the main person for us to
Today's
give
program.
us today's program. Thank you, Dr. Shailaja and Dr.
Yes.
Sangeeta. And Dr. Himabindu, madam, you are definitely going to enlighten us. Thank you very much. Thank you for giving me opportunity.
Yeah. Now I think we will directly go to the program because I know that the blessings are always with us from all the dignitaries of Central IP, Central EHA, Maharashtra IP, and Maharashtra Adolescent Health Academy. Now, before just proceeding, I want to introduce our two chairpersons for today's program. First chairperson is Dr. Nishikant Kotwal sir, and Nishikant Kotwal sir is a past chairperson of Maharashtra Adolescent Health Academy. National Coordinator, Adolescent Health Academy, Teachers of Self-Learning Web Module, TTech Module 2024, Director of Adolescent Health and Counseling Institute, Nagpur. He has national publication and is an author of chapter 3, Adolescent in IPH textbook. We are delighted to have you, sir, as a chairperson for today's webinar. And our second chairperson is none other than First Lady of IP, Dr. Pragati Khalatkar, who is consultant gynecologist and obstetrician, Director of Khalatkar Hospital for Mother and Child Care. She is President of Menopause Society Nagpur, Vice President of Nagpur OBGY Society, National Coordinator for Saath Saath IP Foxy Initiative, and above all, as I told you, that she is the first lady of IP because she is wife of our Central IP President, Dr. Vasant Khalatkar sir. So most welcome you all to both chairperson to this webinar. And now I'm going to start the program. And before just inviting our first speaker, I just want to say that why this topic? Teenage pregnancy in India is not just an unspoken issue. It is a silent crisis. For too long, it has been pushed into the shadows, wrapped in stigma and silence. But the time has come to bring it into the open, to talk about it, to address it, and most importantly, to act on it. Because the real change begins with real conversation. Which are the irreparable impacts of teenage pregnancy? What are the life outcomes for the mother, baby, and their family? How to approach teenage pregnancy holistically? Let's listen from our first legendary speaker, Dr. Himabindu, who is a president of Central Adolescent Health Academy. Madam, before starting, you just give blessings and then we will proceed for the program. Dr. Himabindu, madam.
Okay. So I'm just sharing my screen for want of time. Yeah, thank you, Dr.
Sangeeta.
Dr. Sangeeta
Shailaja
and
ma'am.
Maharashtra Academy of Pediatrics. In fact, I'm so happy that the Maharashtra Academy, who has been installed recently, the new body has taken over. So they have immediately started all academics. And the topic which was selected is again teenage pregnancy, very, very close to my heart. Really thank Dr. Shailaja, Dr. Sangeeta, Dr. Nishikant Kotwal, Dr. Chitra Kulkarni, and of course Abhijit and Amol Power. I mean Sulba. Sulba is also with us. Of course, Amol is always there. We saw him reaching the skies. And also Dr. I can see Jitendra. Many of our EB members are here, Dampuri. And I really thank Dr. Vasant Khalatkar and both Pragati Khalatkar who are supporting our IAP. They are both a right combination for us, being pediatrician and gynecologist. And I love the Dr. Pragati's approach. And therefore, I too call her very frequently, and she's part of our many missions on girl child also. So with this, I think we should start talking about breaking the silence on teenage pregnancies, uncovered. A nice title given to me. When I myself, though I'm in a, working for AHA for a long time, I'd been in a medical college and I started a center called UA, Center of Excellence on Adults and Health. And I've seen some teens, 12 and 13-year-old coming with pregnancy. It was very shocking to many at that time. That was 10, 15 years back. And people used to talk something, ऐसे कैसे हो गया? ये पता ही नहीं चला बच्ची को ऐसे कैसे, उसका character ऐसा है, ये सब चीज. So it was very difficult to, it took a lot of efforts to make all the people there to become adolescent friendly, non-judgmental, being unbiased, and actually help those teenagers. So when I used to ask them, they say, we never knew that intercourse leads to pregnancy. So that was something which that's why I took up sexuality as my, I thought that was a very important issue which is being neglected. And I usually talk about sexuality and sexuality. and through our cascading module in the AHA, through all the state branches where Maharashtra also will be involved. And we would love to see this being talked in the schools and colleges, how to prevent teenage pregnancies, including this topic. Yeah. So first of all, let us see what is a burden and what happens when teen pregnancy happens and why it is happening and what to do to prevent teen pregnancy. So teen pregnancy is, by definition, whenever a teen becomes pregnant, it is called teen pregnancy. And it is actually a very, very significant public health issue. And with the World Health Day recently being celebrated, the focus was on it was around perinatal. So the focus came on teenage pregnancy again. And they said there was a global call now for reducing teenage pregnancy. I think IAP and AHA should join this global call. And we have to see how we can help the government and other agencies on this public health issue. It is very common in the low middle income groups, countries, where our adolescents between 15 to 19 are becoming pregnant. There's a burden of 21 million pregnancies each year, with approximately 50% being unintended. That means they are not planning pregnancy but becoming pregnant. So maybe due to lack of safe sexual behavior and their lack of awareness or lack of access to healthcare. So let us see that, and we need to really tackle this and see the global burden too. So if you the annual birth rate, this is all WHO statistics. The birth rate has decreased, though it a little decrease is there from 64.5 to 41.3 in 2023. Still, I think this is a huge burden. 16 million girls between this age of 15 to 19 actually give birth annually, and 90% are there. This burden is mostly in the developing countries. Then one foundation, the Save the Child Foundation, has found that annually 13 million children are born to women between the age of under 20. And 90% again, they also found it is in developing countries. And the characteristics of these young mothers are very typical across all the regions in the world. Most of these young mothers are getting pregnant. When the teenagers who are becoming pregnant are less educated, they are from the rural background, and they are poor. So maybe these are the social factors which will, they have high risk for teenage pregnancy. So this, again, to reiterate, in 2019, the adolescents between this age had 21 million pregnancies, 50% are unintended, and 12 million births have happened because of this. And we have to really tackle this because they're ending in abortions and unsafe, mostly unsafe, which is very much, which is really a concern for all of us. And as I said, 1/5 of these women are living in the poorest regions in the world. And you can see across, not just in India, across all the countries in the globe. Coming to India, our states, if you see the National Family Health Survey 5, 7.9% of our girls between 15 to 19 were either mothers or become pregnant in 2021. That means we have this incidence around 8%. Rural areas, again, significantly higher rates seen than urban areas, especially in states like Bihar, Assam, and West Bengal. They report highest rates of teenage pregnancies in India, whereas little less in other places. Now, just we come back, why we are talking about, adolescence and pregnancy. What are the typical, this age group is a little different. We know that, there's a rapid physical changes. There are even the thinking, the mental changes are there. They want to enjoy fantasies. They don't see the consequence of behavior. Why we need to know about the actual, the physiology of adolescence is, while dealing with adolescents, we have to keep this in mind. There are physical changes, the mental changes. You cannot tell them preaching that aise karne se aise hoga. They really cannot foresee the consequences of their behavior. So it is, while we counsel them or deal with them, we have to keep the physiology of adolescence in mind. Even when they are in the middle phase of adolescence, when they, it is difficult, we have to deal with them a little differently because they usually have the tendency to challenge authority. They experiment with drugs, alcohol, and they have this, controlled by peers, and they have external forces or the influence by the media. All this will be there. And concrete thinking, and when the thinking matures only after 2025. So late adolescence, then this thinking becomes little abstract now, and they can anticipate the consequences. So this is the time when we say legal age of marriage, 18 maybe was decided, and we are still pushing this age to 24, 25. We AHNs would like to see, because we know the frontal cortex matures only at that time. maybe at beyond 20, at least it's a little better. So the social and other cultural factors, poverty and educational achievements, they also play a role. High-risk behaviors is a very common among adolescents. They are very, very vulnerable, and they can have sex. 46% of all teens between 15 to 19, this is reported. They already have sex, and 62%, by their seniors. So media influence is also very high among adolescents. So we have to keep all this in mind when we are dealing with teenage pregnancies, either in management or counseling. So they can also be they can have multiple partners, and STIs are also very common because they may not use safety precautions, and inconsistent use of contraceptives are also there. So we have to keep all this in mind while we are dealing with them. So the psychosocial factors, we know they always would never like to listen to elders. They try to retaliate against the parent, and they can have delinquent behavior. They want to make their own choices, health choices, but they need to be empowered. So the root of the problem in India is actually around this four: poverty, insufficient education, early marriages, and limited access to healthcare, sexual healthcare especially. And child marriages, though it is illegal, we know that 1 in 4 in rural India are still getting married, according to the NFHS 5 statistics. Lack of proper sex education is there still, and the taboo is there. Still, a taboo is there to discuss about sexuality, and because the discussions are not happening openly and healthily about reproductive health, sometimes the decisions are taken without adequate information. Many times, not sometimes, many times. And there's added to it, we have peer pressure. There's a role of drugs and alcohol in the with adolescents. And when they are not having any knowledge about how an intercourse happens and how they have to protect, they don't even know that ovulating. The boys may not know they have carry sperms, and they can impregnate or create a baby, and they can they may not have safe sex, and but this can lead to teenage pregnancies. A sexually active teenager who does not use contraception have a 90% chance of becoming pregnant within a year. So this is what the statistics say. And the potential behavior patterns of a teenage girl, usually this is very typical. The dating is very common among young people nowadays. Now, I was discussing with my medical students also that we have two types of problems in India. We have those traditional child marriages and rural poverty in going on, and we also have in the modern metros. There is a lot of it's very common. Dating is very, very common. Having boyfriends, girlfriends is one of the fashion statements are very common, and in fact, it is uncommon. They feel it's abnormal not to have a relationship at all, and high risk behavior does happen among this age group. They also are entering into physical intimacy without having proper maybe they are not very much now thinking about marriage as the entry point for physical intimacy, and the relations may not be so emotionally attached, so very, very superficial, so they can have multiple partners. So all this is the trends are happening among the youth nowadays. So this is actually a high risk behavior. There's a lack of support group. Unfortunately, the friendships are very superficial. They may have a lot of friends, peer groups, online friends, but they do not have actual support group. So they may be mostly lonely, and they can have mental health issues. Unhealthy environment at home, like domestic violence or single parenting, maybe this kind of atmosphere can also lead to maybe promiscuous behavior. Stress and depression also can lead to teenage pregnancy, because whenever they want some intimacy, the girls and the boys can have physical intimacy because they feel that is love. So mental health problem can also exaggerate the reasons for becoming a teenage, physical intimacy and leading to teenage pregnancy. Criminal behavior, delinquency, we can see that post-coercion sex can also happen because of this behavior. Exposure to domestic and sexual violence is very, very common in India. We really are scared to leave our children at home. And when we are going to work, we don't know what is happening it is really very, very unsafe, some of the places. And of course, financial constraints. Some of the girls are pushed into, sex because of they need to earn to take care of the families. So these are some of the typical scenario. Now let us see what is the impact. We all know that teenage pregnancy has a huge negative impact both on the mother and the baby. The complications of pregnancy like anemia, pre-eclampsia, and preterm labors are very, very common among primaries who are teenagers. And maternal morbidity and mortality both increase. There is high incidence of operative interference, higher rate of sections, higher rate of NICU admissions for the babies, and these complications are leading cause of mortality among women who are bearing children between 15 to 19. Please, we have to take care of the psychosocial effects also. It's all not just medical. Whenever we see a teen who's pregnant, please take care of the background from where they have come, the rural background, the poverty, the education of there is a lot of they usually drop the school. They don't go through their education. They don't complete the education. So they are left, illiterate, and they cannot earn for themselves. Long-term consequences are there. They become isolated whenever a teen becomes pregnant, especially in India and rural areas. So they become isolated because they are shunned by the society. There's a lot of guilt associated with teenage pregnancy. The girl may end her life. She may commit suicide, or they get honor killings in the north. Some places are there. So the family doesn't accept. They feel it is a shame. They cannot live in the same village. So it is so much of stress on the child. And they're, of course, leading to depression and other mental health issues. Low self-esteem can happen, and they can also lose interest in studies. They just move out of school, and again leading to long-term job. They are not financially independent, and their family and friends also sometimes just leave them, and they don't want to associate with that child. And teenage, again, this unsafe abortion is another very concerning issue. If you do not know, we always think कि pregnant क्यों हुआ है, but pregnant होने के बाद में let us at least give them solace, because we as adolescent physicians or IAPNs, we need to help them out from any situation. So we need to be non-judgmental. We need to be we have to maintain confidentiality and privacy. And only once their health risk is there, then only we need to tell their parent. And of course, any intervention we have to involve the parents here. That's a legal issue. So when we do not give them access to healthcare, proper safe healthcare, they tend to go to quacks and have unsafe abortions. Some of the statistics you can see, even abroad, even not just in India, these are some outside India also. So the unsafe abortions are happening. There is a high risk of obstructed labor because they are not grown completely. The pelvis is not maybe ready for delivery. So obstructed labor, high incidence is there. Anemia, most of the girls are so undernourished. We all know that. And when they become pregnant, a girl giving rise to another baby, she herself is a baby. So this is without correction of the nutritional status and anemia. Now, I've also talked about my another favorite topic is preconception care. So without any planning, they become pregnant accidentally. So there's so much to do 4 months before pregnancy, taking care of the nutrition, the micronutrients, correction of anemia, becoming eumetabolic, relaxing, then having a good support system. All that is absent here when they have this accidental teenage pregnancies. So they are at risk for even preterm labors and low birth weight babies. We all are aware of all this. And yeah, just want to, this is what I think one word about this. Pregnancy can, bring status for a marriage. Just this marriage thing is very important in India. कि अगर married होगी, pregnant है तो ठीक है. But unmarried है, pregnant है तो नहीं ठीक है. So we are actually as medical professionals, and you can see the age is actually the bothersome. Whether marriage है नहीं, the social impact can be there. But it is medical reasons we are more worried about also. So the marriage gives status to the woman. But on the other hand, unmarried pregnant teen may be driven away by a family or abandoned by a partner also and be left with no means of support. So unmarried teens need more support from all of us. So because of the socio-economic deprivation, I know this is one voice of a teenage. We young women are not prepared to become mothers, and I would like to continue my studies. This is what they want. But since I already have a child, my options have changed because more obligations are there now for me. And I hope that this will not be a barrier for me to succeed in life. So we need to hear the youth voice. I'm so happy that one young is there among us today. I really congratulate Dr. Sangeeta and Shailaja to have invited a youth voice for us. So this is one thing, this is very interesting. So why don't we tell our young people, empower them, and tell them, bhai, your body is yours. Please learn about your body parts. Know that you can become pregnant, not just about menstrual hygiene. Learn that how to protect yourself. And of course, abstinence first. If not, please protect yourself. And in case you become, I know you already had a sexual exposure, don't hesitate to at least open up and tell. And we are there to help you. The emergency contraception also is need to be available for them, but it's not for promotion of unsafe sexual behavior. It is only for accidental exposure. And let them also at least have safe sexual behavior or use condoms or something. So that much तो बोलना चाहिए for our young people, because उनको हम खाली बोलेंगे सेक्स मत करो, वो नहीं सुनने वाले हैं, आजकल तो कर रहे हैं. So let us tell them at least कि दूसरा कुछ बोलेंगे which will attract them. If you finish your high school and get a job and get married before having children, you have 98% chance of not becoming poor. Maybe some things like that, because उनको पैसा कमाना भी है, they want a good lifestyle. So let us think of good catchy things, how to make our young people, to say no to teenage pregnancy. So strategies, some of the strategies which came to my mind is, first of all, let AHA and IAP and all of us provide information and education to all our young people. So they are now about 10 or 11. They have a right to know about their bodies. We can talk to them, and age appropriate information should be given. Promote individual responsibility. Tell them you are responsible. Don't tell this about कि society, parent, वो दूसरे लोग responsible नहीं है. You are responsible for your own body and your own health. Protect yourself. You need to tell them about protective methods. Make them aware that drugs and alcohol and sex, they can be combined, and please do not get into that rape, that drugs addiction, how the risk can happen. So when they are partying, they should be in groups and always refuse all those things, because without their intention, sometimes they can get sexual exposure. So, and we also need to provide health services. Please, let us not refuse them. Let us accept them. They are just children, maybe little older young adults, and they are not mature yet. We all know that as adolescent physicians. Let us be little sensitive to this topic. उनको अच्छी तरह से समझाएंगे that your body का अपने hand में लेना है responsibility, and also tell them अगर कुछ भी हो गया accidentally, because they don't have planned, they don't plan, it sometimes happens accidentally. So उनके at least how to come out of it, counseling करके. We can also give them emergency contraception in case it is needed, but please give them adolescent friendly services, at least where they can come and open up and talk. So strategies, empower yuva. I came back to this because this is what AHA and IAP is now rolling out throughout the country. We want them to be empowered sexually. We want them to be educated about sexuality, about the use of contraceptions, and how to reduce, how to say no to forced sex, how to be aware about abuse and report about POX as per the POXO Act, and how to prevent early marriage. Legally, we are saying no. Children also, even in rural areas, we should empower them. They can be themselves leaders to say no. Monitor the influence of media. Please, we need to counsel both male and female. Here, I just put highlight of male because sometimes we only talk to the girl. कि भाई ये नहीं करना है, वो नहीं करना है, be careful. But what about talking to the boys? Please tell, counsel the male adolescents also. Then provide career counseling. Instead, focus them that you're not here only to produce babies, the girls. So you're here to make your own career too. You can also become financially independent. You can have more confidence in dealing with life challenges. You can have more say and live your own life. And you need not be dependent on your husband or any challenges that come. We can also rear your babies. So career is very important. Educate about abstinence and of course sexual other risky behaviors, and promote gender equality, that we need to do, that girls are not just dolls, they are not just sexual objects. It is about respecting each other, and how to, and once say no, it is no, that we need to tell the boys and the girls. We have to promote this, develop a good relationship with of course the parent. This is for the parents. Monitor the activities and have good peer education programs. Safety net is important. Please make emergency contraceptive pills available and accessible. Even providing safe abortion services and effective post-abortion care is what I'm also going to talk about a little bit. But then ultimately, I would say break the silence about sexual coercion, and please bring this out. Don't be silent if there's an abuse. Protect yourself and report. I think once they are pregnant, also, of course, it is our duty to see that they do have a proper care. So coming to Yuva clinics, just one word. So let us know, we have been doing capacity building of our pediatricians all over since last 25 years. So this year I was thinking as AHA and all the members here, we want to start adults and primary health services somewhere, maybe in the medical colleges where it is feasible, where people are non-judgmental and provide privacy, and they should be unbiased. They should not talk about the character of the, we are nobody to talk about the character. Clear, the support should be there from all the stakeholders, parents, teachers, and healthcare providers. So this is a call for action. The youth wellness module, empowering the Yuva is also action plan of IAP and AHA. And this will be cascading to all the pediatricians. And we request all the pediatricians to do such awareness programs and empower the youth in the schools and colleges about healthy sexual behavior and sexual wellness. So we should not shy away from this topic anymore. I'll leave these key messages. Teenage pregnancy is a burden, still a burden. The teenagers are at risk due to absence of their proper guidance and counseling. Teenage pregnancy does have a bad impact both on the mother and the child. Preventive strategies are to be put in place. Empowering Yuva is one of the most important strategy to prevent teenage pregnancy, and also giving access to adolescent-friendly spaces and establishment of Yuva clinics will go a long way for adolescents to walk in and open up and talk to us. And of course, the family and the community should be very, very supportive to deal and eliminate teen pregnancy. Organizations like IAP, AHA, the Women Period Forum, FOXY, IMA, all have a crucial role to play. So let's call for action, breaking the silence. Let's uncover, rather empower our Yuva and join the global call to reduce teenage pregnancy. Thank you so much, Maharashtra AHA, for giving me an opportunity. And thank you once again. Thank you. If there are any questions,
Thank you so much, madam, for this insightful and informative session. Very important points about the teenage pregnancy were highlighted impactfully. Now, I request our chairperson, Dr. Nishikant Kotwal sir, to just give his impact and this insightful message regarding this.
Wonderful lecture, Dr. Himabindu. I know you are expert in it and you are already dealing and mixing with the Yuva, so you know the pulse of it. The definitely the child pregnancy has come down to now teenage pregnancy, and that is why the maternal mortality and infant mortality has gone down. I have only few points. We have a permissive society which accepts the relationship between the genders, but at the same time we do not want to educate them openly about contraceptive methods, and this is a paradox. There is another survey which I have seen pre-COVID and post-COVID. When I saw 2016 statistics, till that time the teenage pregnancy were much more. But because of RKSK and adolescent-friendly clinics, the rate of teenage pregnancy had really gone down. But the unfortunate part was the moment COVID came, everything changed. Now, why do we have now more teenage pregnancy? Is during COVID, many people lost their jobs. So what they thought was to get this teen girl married so that the responsibility of the house, the financial burden of the house is less. We are not talking to them about emergency contraceptives. Remember, their risk-taking behavior is much more. The recent survey which was done in GMC Nagpur shows that still legal, we are talking about legal teenage pregnancies also, is much more. So I would say poverty has led to early marriages, post-COVID, loss of job, the culture, marriageable age is much more. And that is why sexual relationships are occurring in a normal hormonal age. The teenagers should also remember the rape drugs, the drugs, and the vulnerability. Thank you very much, Himabindu madam. It was a wonderful.
Rightly said, sir. It is a very hot topic and lot of controversies and debates can happen. But I think we just started talking about it as most important. Thank you.
Thank you, sir, for your expert comment. Now I invite our next dynamic speaker, Dr. Shilpa Sagar, madam. She is a consultant gynecologist from Pune. Pallavi ma'am, please play the CV of madam. Shilpa ma'am. Shilpa madam is a Associate Professor of D.Y. Patil Medical College, Pimpri, lactation consultant, and she is on editorial board of JOGYP, completed advanced course in medical education, and she is life member of FOXY, BPNI, AMASI, and IMA. She is passionate writer, and she has received many awards. Women Par Excellence Award in 2021, Dr. Smita Jog Award for Work in Adolescent Health in 2022, received 5 state national awards for photography, poem writing, etc. Nari Ratna Award by NGO in 2024, and various awards for writing health awareness blogs. And apart from that, she has received 28 citations as well. So over to Dr. Shilpa Sagar Madam. Her topic is Teenage Pregnancy, a Reality Check. Over to Dr. Shilpa Ma'am.
Thank you, Sangeeta ma'am. In my CV also that I like to work in adolescent health. So this is one topic which I really want to talk upon. So thank you so much. So is my presentation visible?
No, ma'am, not yet.
Okay. I don't know whether your concern while choosing this topic was it was just in your process that you thought of doing teenage pregnancy, or is it in view of upcoming May? The month of May is celebrated as the Teenage Pregnancy Prevention Month. So if it is in alignment to that, it is very nice, and I want all the participants or all the listeners to have a serious thought about this month, why this is celebrated, so that we can all spread the awareness. Is it visible now, ma'am?
Yes.
Yes, ma'am.
Okay.
Ma'am, kindly make it full screen.
Yes, yeah, I will make it.
Yeah. Kindly start slide.
So as ma'am
Thank you.
introduced, the one more introduction is I am mother of a teen son who is 14 years now. So basically I can understand what are the problems and how rebellious they are and how they are not just listening to us. So I can definitely understand what is they going through. So my question was, still we are not yet sure about the definition of adolescence, because as per the program changes, the definition of adolescence also changes. But at the last, the question is, does it matter? So suppose, for example, yesterday she was 17 year 11 months and 364 days, and today she is 18 completed. Does overnight she become so much mature by thoughts, by her activities? So it's surely not. So we should be able to understand the agony of youth as well. This may be related to the law, and when we are in sticking to the frame of the law, we have to follow certain things, but same time we have to understand the psychology of the youths behind this delineation as well. So teenage pregnancy, is it only a few points will be definitely overlapping, because just now we had a wonderful talk from the madam, and it has given a nice introduction and almost cleared my path about the basic concepts. So I would like to share my one of the experience, like when I was doing my MO-ship in my after MBBS. That time it was a dengue outbreak and chikungunya outbreak, and it was a quite very heavy OPD. After that OPD, around 3 o'clock, one adolescent girl, maybe 16-17 year, came, and that time it was not POXO Act. She came to me and she told that she has missed her menses. After examination, I was already irritated because of the heavy OPD, and after examining her, I came to know that she is already in the second trimester of her pregnancy. And because she was minor, I told her that you come tomorrow with your parents and we will discuss. In all PHCs or in all such areas, there is one person who knows each and every person in the village. So there was one person who was knowing that girl, and as soon as she exited from my OPD, that person asked me, ma'am, is she pregnant? Is she the XYZ girl? I said yes. Then he said, I knew that she is pregnant, and I know the guy who made her pregnant. So I will handle it, don't worry. I told him we will discuss tomorrow with her parents and let's see what happens. The parents never turned up, the girl never turned up, and after a month or two she met me at the bus stop and she said my life is ruined. So I asked what happened, because I could now see that her tummy is quite visible. So she was carrying the pregnancy, and of course she did not have any choice because she was already had crossed that window. But she said my life is ruined because I was forced to marry that guy. So this is the situation in India whenever there is a teenage pregnancy, the outcome is not only in the form of maternal or perinatal morbidity and mortality, but it also affects the whole lifetime experience for that girl. And I was very annoyed, or rather than annoyed, I was very depressed when I read such news that one of the High Court gave the judgment that if that boy is ready to accept that girl, if that boy is getting married to that girl, his rape punishment will be abolished. So this is actually shocking that if you are forcing that girl to marry with that person, it may be a lifelong trauma to that girl. So today definitely we will discuss about the gynec perspective, but also what is the difference between teenage pregnancy between married and unmarried girl. Few points were discussed by ma'am also, and the social aspects and law, which is a practical point, what to do when such girl comes to us. So these points have almost been discussed. What causes them to get promoted or compelled to do sexual activities? Mainly, it may not be their routine behavior to have sexual activity, but just the feeling that I am grown up, अब मैं बड़ा हो गया हूँ, और घर पे कोई बोलता है कि अरे अभी तो तू मर्द हो गया है. So these kind of things can also force them to get indulged in sexual activity. And as ma'am rightly said, alcohol and drug abuse, because the alcohol and drug abuse reduces their capacity of thinking, and in that addiction, under the influence, they might undergo such kind of behavior. There are very famous shows. One is Teen Mom and the other is 16 and Pregnancy, and such kind of shows. The Teen Mom is available on Netflix. These kind of shows are making these teenage pregnancies as a normal event. I'm not saying they are promoting it, but in their view, it may not be that much traumatic, or it is not a stigma, and it is absolutely normal. So are we normalizing it is the question. So from all point of view, I think if you feel your child is mature enough, the psychologically as well as physically, to understand all these problems, then only we should be promoting and have some kind of access to the social media about these questions. So teenage pregnancy in India, is it by choice or by force? As you can see in the first pregnancies, especially in married girls, we are expecting a bonsai with the tree has not grown, but we are expecting a fruit whenever the married teenage girl comes to us. Or sometimes the unripe fruit is plucked. That means she is forced, she is the victim of either a sexual abuse out of rape, or she may be abused at domestic level also. This is very common in India. So there are differences between these two. So as we can see, the data retrieved from the NFHS in the 2019 to 21, that is NFHS 5 and 4. So we can see, I have underlined with the arrow. So the women aged 20 to 24 years, right now they are 20 to 24, but they got married before 18. So in 1920, between 19 to 21, the incidence was 23.3, which was 26.8. So hardly any difference, but still I can say at least 3% difference is there. But if you see the women aged 15 to 19 years married or pregnant, the number is almost the same, 7.9 and 6.8, only difference of 1%. So even if we have moved over 5 years, the difference is not much. And 6.8% women aged 15 to 19 were pregnant during the 19 to 21 survey. So my question to the audience, you can just scan the QR code and answer the question. If unmarried girl under 18 years report to you, what will you do first? She's less than 18, say 16, 17. What will you do first? Because all of us know that there is a POCSO Act and we have to report such cases. So would you treat her and then do MLC, or first you will do MLC and then treat her? Okay, so almost 75% are saying that they will first do MLC and then treat her. So my question was, she is unmarried under 18 years. So what will you do? So the answer is, if she is unmarried and she gets pregnancy, of course good news is no more a good news. If she is under 18, MLC is must because of POCSO Act. But if it is an emergency, for example, she is bleeding, she has just undergone the abuse and she is bleeding, or she has any kind of complication. For example, I came across such a patient who had ruptured ectopic pregnancy. She was unmarried and she was under 18, and I came across ruptured ectopic pregnancy. So at that time, it was mandatory to treat her rather than running behind MLC. So if it is an emergency, first treat her. The MLC part can be done simultaneously, but do not wait for the things to happen, because as we know, the sample collection under the POCSO Act is done if she reports to you before within 96 hours. So as she has become pregnant, so definitely this assault has happened probably a month back. So rather than concentrating on whether I need to collect the samples, whether I need to report to government hospital and all those things, doing the MLC, informing the police and starting your treatment is more mandatory. History taking is an important step because as I said, domestic abuse is also very common in India. So just soothing her and taking the proper history will definitely help you. Involving the parents will be definitely debatable if she is more than 18 years, because after the age of 18 years, she is allowed to give consent for whatever MTP or continuation of pregnancy, whatever she wants. So if she has not completed her 18 years, definitely we have to involve her parents. If she has completed 18 years, it depends, it should be a discussion, and still I would say, if she agrees, if she understands whatever you are saying, it is better to involve her parents. Necessary investigations, as we do in all antenatal patients, are mandatory for these teenage girls as well, irrespective they are married or unmarried. And the decision regarding continuation or termination of pregnancy should be taken by her consent or assent if she is less than 18 years, but between 12 to 18 years, you have to take her assent after explaining the pros and cons. So teenage pregnancy in married girls, as we have seen, there is a majority burden, almost 1/3 teenage girls who are married comes from India, and in that the highest is seen in the West Bengal and the Bihar area. The incidence is as high as 16%, 11%. Overall, it is around 7%. But if we consider those states, especially, the incidence is very high. So what basically pushes her to be pregnant is mainly the poverty, as sir just now described, as well as the societal pressure, and she has to prove that she is fine, she is healthy by keeping the pregnancy. So even if teenage, she is forced to become pregnant. So do you feel pregnancy in married minor, so she is married, she is suppose she got married at the age of 16, because it is still very common in India, and she comes to you, what do you think? Should we notify the police or not? there are concerns. Some feel we should be notifying it, some feel we should not be notifying because she is married, and still in India child marriages or the age below 18 for the marriage is still acceptable, and so we are not supposed to notify it. So I am very happy that 100% are answering that you should it should be notified to police. I totally agree that our hospitals are not jail, but definitely we should not create trouble for ourselves because her parents created trouble for her. So it is our duty, it is mandatory to notify such cases under POCSO Act. Many times it happens that if she is married, if she has some kind of proof, marriage certificate is practically not possible because registration will not happen, but some kind of what we can say invitation card of the marriage or some photos of the marriage, then it might happen that even the police is not coming immediately, and they come after the patient is discharged, and in that situation we can just provide them the details and they can do their further work. So where to report? So if you come across a child marriage which is actually happening, so it is the site where you will register this child marriage, and beware that you cannot report fake, because if you are reporting fake then you will be punished. It is a online form and it has various detailed information which you need to fill. For POCSO, where you will report is a special juvenile police unit or local police authorities, which we prefer as soon as the patient comes to us. So married minor with pregnancy should be treated same as POCSO Act. And there is one more child marriage reporting form which is given by Ministry of Health and Welfare. And to be very frank, I also come across this form just 3-4 days back, that such kind of form is available in government hospitals, and I could not actually see the form. I saw on the website, but it is not available on the website. Just a few days back I came across the form, so if I get it I will definitely share it. So as ma'am also said that teenage pregnancy are sometimes diagnosed very delayed because of all these problems, because they have irregular menses which may be related to immature hypothalamo-pituitary axis, or they are the PCOS, which is very common, unawareness of mother and girl, Gen Z privacy. I actually came across a patient who was a teenage, and she was pregnant, she was 4 months, and I just she came with the mother only, and she told her mother at the same time, and I just asked mother, didn't you notice that she did not have her menses in the last 4 months? That time mother said कि मैं उसको कुछ पूछूं तो उसको गुस्सा आता है, वो बोलती है अभी तू इतना वॉच रखेगी क्या मुझ पे, मेरी कुछ प्राइवेसी है कि नहीं. So Gen Z is of that mentality, and they may not be liking the private personal questions, and that is one more hindrance for the diagnosis of pregnancy. Embarrassing or shy feeling to tell that I am pregnant or I have my menses are missed. There is no free communication. कोई पास जिससे सब कुछ बात कर सके, ऐसे घर वाला या फ्रेंड ऐसे कोई नहीं है. Then delay in acceptance कि ऐसे मेरे साथ कुछ हो सकता है. This is also one of the reason. Homely remedies for abortion. Still we come across situations where they will say कि मैंने नींबू खाया, पपाया खाया, मुझे लगा मेरे पीरियड्स आ जाएंगे, मुझे लगा कुछ ठंडा हुआ, गरम लिया, whatever their reasons. So they because there is a delay in acceptance, and they may try sometimes other than medicine. कोई बाबा के पास ले गए, किसी के पास ले गए. So these are the problems in the diagnosis of teenage pregnancy. So once the diagnosis is made, usually in married, there is no question of termination of pregnancy. But in case of unmarried, if there is option of termination of pregnancy, as we all know, there are various options. If she comes to us before 9 weeks, medical termination with mifepristone and misoprostol is preferred. Between 9 to 12 weeks, we go with the surgical MTP. Between 12 to 24 weeks, it is mini labor induction with prostaglandins, and as we know, the amendments in MTP Act, till 20 weeks sign off only one registered medical practitioner is required. After 20 weeks sign off, 2 RMPs is required. Now, if she is coming to us after 24 week of pregnancy, then the decision is taken by medical board, and usually the notice is issued by the court to the medical board, which is usually situated in the civil hospital, like in Pune it is in the Sassoon hospital, and that board consists of various authorities like the HOD of obstetrics and gynecology department, radiology, the medical superintendent, the HOD of psychiatry. So it is a team which involves the multidisciplinary approach, and then they will think what is beneficent for the mother, whether to continue the pregnancy or termination of pregnancy. So considering
Shilpa
her
ma'am.
health risk,
Shilpa ma'am, we are just running short of time, so please
yes,
it
okay,
fast.
okay.
It's a kind request.
So these are the risks. Most of the risks have been discussed by ma'am also. There is a risk of anemia. So timely diagnosis and intervention under the Anemia Mukta Bharat Yojana. And because they are also at high risk of pregnancy induced hypertension, early detection and better control of hypertension is required. Because they are at high risk of having preterm birth, it is better to deliver them at a tertiary center if you are expecting preterm delivery. Postpartum complications can also be there, like postpartum hemorrhage or postpartum depression. What are the problems with the fetus? There is an increased risk of perinatal mortality. The perinatal mortality may be related to physiological immaturity as well as the compromised prenatal care. Low birth weight, low ABGA scores, fetal infant accidents are also known to be increased, especially the in bed accidents are more common with the babies born to teenage mothers, and low intelligence was found in a study, especially in the black women, and in the white women there was no difference. So does it end here? Of course not. As ma'am also discussed, there is a lack of interest in studies, work, increased incidence of STDs, aversion to sex in future, and psychological issues. So along with this, this was also covered by ma'am, that social effects are also too much with the teenage pregnancies, and the only solution madam explained in detail, so I am not going into details. Education, especially the sex education, is very important, and I think at this point of time we should be involving all the priests of all religions and taking them into consideration for educating, not to promote the early marriages or child marriages, and that might help us. So this is a very important slide which was shared to me by my unit head, and this I use almost in every adolescent presentation, that you need to explain them. 20 से छोटे भोले भालो, तुम जितने चाहे दोस्त बना लो, आंख लड़ा लो, खूब बतिया लो, शायरी कर लो, गीत सुना लो, पर अभी बिना सेक्स के काम चला लो, कुछ तो भविष्य के लिए बचा लो. So this way you need to educate them, especially about the HIV and sexually transmitted infections, and whatever contraception they are using, barrier contraception is must. They can use, in addition to barrier contraception, oral contraceptive pills or even the IUCDs. But even if they are using it, you have to educate them for using the condoms. So take home message, educating teens from not being sexually active is the best prevention for teen pregnancies as well as for preventing STDs. And if education is not compelling people to behave sane, law comes in action, and whatever the reason, whatever is the outcome, we doctors should follow the law at our end. So even if you come across teenage pregnancy, you are empathetic with her, it is very good, you are taking care of her, but please do not breach the law, do the necessary things. And it is applicable to all of us, that stop saying it would never happen to me, don't think it will happen to my neighbor's child, don't think it would my family is very cultured and it will not happen to me. All of us should be aware that it can happen at my home also. These are my references, and thank you so much for giving me opportunity to speak in this webinar. I am really thankful to all listeners as well. Thank you.
Thank you very much, Dr. Shilpa, for revealing the important aspects regarding teenage pregnancy. Now I request our chairperson, Dr. Pragati Khalatkar ma'am, to give her expert comments.
Very good evening to all. First of all, I extend my really gratitudes for making me part of this wonderful program. And really, it was so nice to meet all the dignitaries of IIP Central, meet all the AHA Central body, AHA Maharashtra body, and I have become your family member. Like you all keep on giving me the respect, and I understand this is my respect for a year. But I carried my connection with IIP from years, and now I have also become, I have crossed that adolescent phase of being connecting with IIP and working with IIP. So apart from this thing, Dr. Shilpa, your talk was
Absolutely.
excellent. You have covered all the aspects related to teenage pregnancy as all the gynecologist perspective, everything from the psychology, the physical portion, the effect, the reasons, and what can happen to the patient, and what problems we face in treating all these patients. Therein we get these patients. But what I wanted to mention was incidence was mentioned by Dr. Hemamid was 21 million teenage become pregnant every year. And out of that, 50% are unintended. So can't do anything. But 50% are intended. So see the magnitude of problem that 50% of 21 million, nearly 10 million every year are intending to getting into intercourse, and they're ready to get the pregnancy, childbearing, child rearing, which is such a difficult task. So here come the role of education, and definitely sexuality education, making them, empowering them, and making them understand that what it means to have a pregnancy, to have a child. As really Dr. Shilpa has mentioned, she is a mother of teen. Nowadays, people add to their CV the bottom line mother. Now this is another, one more star, that mother of a teen. So these are the things. Then apart from this, what I want to speak on this platform is specially able girls or specially able kids. They are victimized. They don't understand anything. And they are easily abused. They are easily taken into, confidence, and then are not able to speak. And when a normal girl is not able to recognize a pregnancy, what about those girls? So because this is an adolescent platform, I just want to bring to notice that really special care has to be taken for these specially able kids. Many times we get parents who come with their girls to get them hysterectomized for the reason for fearing pregnancies and all the related thing, and with very heavy heart we have to get their hysterectomies done, which we don't want to do, but then it has to be done. Getting them away from the menstrual problems which they are suffering. Apart from them, they are so, victimized for the reason. One more thing, everything was covered that these pregnancies make this girl fall into so many disorders, so many pregnancy-related disorders, and her life is at stake. One more thing, if the babies are born, there's also increased incidence of birth defect, because many times these pregnancies are not planned. One more point which I want to put very well, we have explained how to get rid of these pregnancies by methods of abortions, medical abortions, surgical abortions at proper time, at proper places, keeping in mind the POXO law. But if the patient comes to us very late, she's already 30 weeks, what to do? So there are many NGOs, many agencies where they can keep this adolescent girl. They take care of these girls, and whole treatment is done, and these babies are delivered, and these babies are given for adoption. These thing also should be aware, in spite of these girls are just thrown out from the family to die alone. So there again we have to look after these adolescent girls, that they should not it should not cost their life. And illegal abortion, 37% of maternal death are due to septic abortions. So that is a very high incidence. We should make them realize the importance of contraceptive, how to get abortion care, and how to get safe abortions done. So thank you for making me part of this important discussion. Thank you so much. Dr. Hemabindu, your talk was excellent. We didn't speak then. Really love to hear from you all. Thank you so much. Thank you, Dr. Sangeeta. Thank you, Dr. Nishikant Kopal.
Thank you.
Thank
I
you.
assure you we'll have a
Thank you,
long
Dr. Pragati
conversation.
Madam.
Yeah.
No, I
Thank
assure
you,
a
Dr. Pragati Madam, for
long-term
highlighting the important points, and particularly special girls. And I also know one, and I have worked with that Anath Ashram run by one doctor family. This is the fourth generation which is running now, who take care of such girls, and even they adopt give for adoption, and those girls who were not able to be adopted, means they do marriage, कन्यादान करते हैं खुद के हाथों से दोनों को, और उनके भी डिलीवरीज एक दो खुद के हॉस्पिटल में करते. Dr. Pathak from Mirrors. There are legends like this. Thanks for highlighting that point and excellent comments. Thank you, Hima, for excellent talk.
Yeah.
Thank you.
What message, one more message which Foxy gives is that we can't become parent to these girls and these adolescents. We have to give them service. We don't have to teach them to play safe sex, but we have to teach them. That is that we have to give them services. Thank you, sir.
Very true, sir. Very true, ma'am.
Yes, ma'am.
Now, third topic. Youth of India represents largest segment of population. They play a critical role in shaping nature's future. They are full of energy, ambitions, and innovations. However, they also face mental health pressure and various challenges and need thoughtful attentions and support. AHA is encouraging a new wave of youth involvement to address their needs and to give them a voice. For today's webinar, our youth champion is Miss Ninisha Chumale. She will be talking on rebellion and the mental process behind having intimate relationship at a young age. Ninisha, a 17-year-old activist and aspiring neuroscientist, is passionate about understanding the brain and finding cures for currently incurable disease. Her curiosity fuels her ongoing work in brain regeneration research, which was recognized by the 5th annual Stanford High School Neuroscience Forum. She also founded the Anvaya Initiative, a student-led movement that creates a safe spaces and helps girls learn to recognize, resist, and report abuse. Since November 2024, her team has reached over 4,000 students in Nasik with programs designed alongside psychologists. Ninisha believes in the power of young people to shape a world that protects dignity, peace, and the future of every girl. Over to Ninisha, and now the forum is yours. The board is yours.
Thank you so much, ma'am. Is my screen visible?
Yes.
Yes.
Okay. Just a minute.
Yes, just make it a full screen.
Yes. Hello, everyone. I am Nanisha, and today my topic is rebellion and the mental process behind having intimate relationship at a very young age. So both the ma'ams have already discussed upon these factors, but I would quickly like to overview the root causes, cultural norms and financial pressure. Despite the legal age of marriage being 18, early marriage is still widely prevalent in rural areas like Mewat. In many communities, girls are seen as financial burdens, and early marriage is seen as the only way to reduce poverty. Now, in these child marriages, girls often face pressure to conceive early to prove their success in the marriage. This results in early motherhood. Another aspect is sexual violence, which I actively work against, wherein many girls become pregnant as a result of any kind of sexual violence for that matter, and often by someone they already know. And although they do understand to some extent that this is not right, the fear of stigma, broken justice systems, and societal shaming keeps them away from speaking up for themselves, standing up for themselves, or simply seeking help. So, as we know, these pregnancies are not by choices, they are consequences of violence and silence and have a huge impact on the mental health. I would like to talk about the recent statistic. We've heard 2 times that the overall pan-India, 6.8% of pregnant women are teenagers. And a recent statistic that so many of people are discussing is that in Karnataka alone, 33,621 teen pregnancies were reported. But it's not that all of these pregnancies, all of the 33,621 pregnancies were a result of child marriage or sexual violence. In fact, some were consensual relationships as well. So to better understand, we could actually look into a 16-year-old girl's perspective who isn't a child bride. She's just a girl who, like many other girls her age yearns to be understood. She might not have a healthy environment at home, which 77% of Indians think that their home is not having a healthy environment, or in school, wherein bullying has been so prevalent that her emotional needs go unaddressed. But then someone makes her feel seen, and in that connection, she discovers a fleeting sense of control, wherein she thinks that, okay, finally someone understands me. But in that relationship, when that turns into physical and unknowingly results in pregnancy, we often rush to judge the outcomes, but very few actually pause and ask that what really led her into that situation. So this is the story of lakhs of girls in India, and yes. So through this perspective, one question that must come into our mind is that why are so many girls seeking intimacy early? So we could actually understand girls. We could divide them into two aspects: rural and urban. Um, in rural areas and urban areas, there is an absence of safe conversation because it's too taboo and makes us feel uncomfortable talking about relationships, sexual health, reproductive health. A lot of times, we don't have the emotional support. So, in Indian families, for example, especially in rural areas, girls are often told what to do, what to wear, where to go. And although this is care by the parents most of the time uh, to keep their girls safe, at adolescence and during puberty, a lot of teenage girls feel that their lives are being controlled and they feel invisible and powerless. So they have this desire to be seen. And then comes the gender inequality part. I think I won't really say not only in rural areas, but also in urban areas, wherein societal pressure to remain passive can push girls into relationships they aren't emotionally ready for, but are seeking validation in unhealthy places. So gender inequality is also one of the reasons why girls get into a relationship. Then, of course, emotional support. If there is an unhealthy environment at homes or school or are safe spaces, then go- girls and boys would go to seek places where people understand them. Then we already have discussed a huge lack of health education. And one point I would love to talk about is misinformation by social media. Social media unrealistically portrays relationship being ideal and effortless, and which is why young teenagers like me, people my age, have this pressure to live up to the expectations those feelings immediately. And what happens is the motivation, and this is where the psychological problems come into play. So if we were to understand the neuroscience of teenage and rebellion and risk, we know that at a young age, our brain is still developing and the prefrontal cortex is not fully developed, which means that our decision making, planning, and controlling of impulses are still a work in a progress. However, the amygdala is actively strong during teenage years, and so adolescents are more likely to make emotional decisions. And our risk taking is also normal at the age. We want to experience everything. So we've seen so many issues or through all of our three talks. So what can we do? I personally work at the very grassroots with teenage girls and boys to work against sexual assault and harassment. And what I have understood is that conversations is the most transformative act. Even right now, when I am presenting, my audience would only be able to understand and agree upon what I am saying if we have a connect. If they agree to what I'm saying, they will understand what I'm saying. And this light also applies to other girls. When I go to villages, I have to wear very normal clothes. I have to speak in their language, in their environment, to make them feel safe and connect, so that they, in the first place, are in the mindset to even understand or try to understand what I'm saying. After that only is the change going to be initiated. So what can we do? Of course, raising awareness. As I already said, conversations are a catalyst for change. Second would be community-led, not committee-led advocacy. Oftentimes when I go online and I go on LinkedIn and I see that there are a lot of programs and initiatives being created from the top to bottom, right? But the real change most from the ground up. Our target audience are at the very grassroots. Them being in rural areas, urban areas, or any part of the India, they are at the very grassroots. And so we should have community-led advocacy campaigns, because people in their areas, such as their activists in that city, know what actually works for their people and not, because they also have gone through the trial and error. Next, of course, is integrating mental health and SRHR services, because in Nasik, if I say, we have pan-India, we have Sakhi one-stop centers. But in Nasik, there's only one Sakhi one-stop center, and it is at least 45 minutes away from major villages in my city, which means that even if a girl is in an unsafe situations and needs counseling or needs a place to live, how is she going to travel 45 minutes if she has no phone, she has no money? Which is why I think that we should have mental health services in the villages locally, not one place in the entire city. Next would be responsible media and digital literacy. I am a teenager, and I understand that media is shaping our minds faster than classrooms or books. Even if we want to study, we would likely learn more from a podcast than a book, because we are much more interested. This is for people who are visual learners or audible learners, right? So if we want to change how girls or even boys or any communities who are setting up some stereotypes, we should focus on what they see and change those things. So how do we do that? I think that we should not focus on deleting what's wrong on the internet, but rather increasing awareness and what is right on the internet, because there would come a point where the good aspects on the media about our topic are more, and so people are more likely to watch them. That is the quickest and most easiest path to go forward with. Thank you so much. My purpose today is not just to leave my audience informed, but also inspired to take initiative towards a vision that's worth fighting for, and that's girls and women's. So, because a teenage girl's body, or any girl, even a woman's body, is not a battlefield for culture, silence, or control. It is hers and entirely hers, and we should work towards protecting that. Thank you so much.
Yeah. Thank you very much, Miss Ninisha. Actually, Vakhri Sonavne, our friend Ravindra Sonavne sir's daughter, was earlier the presenter of this program, but due to some unavoidable circumstances, she had just replaced Ninisha instead of her, and you have just made a good justice to the topic. Thank you once again. And now I request our chairperson, Dr. Salaja Mane Madam, who is Professor and HOD of Department of Pediatrics, Dr. Deva Patil, Medical College, Pune. She is really an amazing personality, Dr. Salaja Mane Madam. I request you to just give your expert comment on this talk of Miss Ninisha.
Yes.
What do you?
Nisha, I really means I'm not having proper words. I'm not able to find out the proper words because such a sensitive topic, and you are just 17 dear. So on behalf of entire Adolescent Health Academy of our state, we like to really
And
salute
center.
that
And
yeah,
center.
hats off,
Yes,
right?
ma'am.
Because he had really covered sensitive topic in such a nice way, and means we are very lucky to have you here. And another point is that too at the 12th hour, not even 11th hour, 12th hour I can say, right,
Yes.
Sangeeta? And
Yeah.
I was worried about, I had discussed with Sangeeta also that whether she will be comfortable to do at last moment. And she said, don't worry, madam, she is an amazing person. So really hats off to you. And we have learned so much from you because other aspect, we are sitting on this chair, but what teenagers really feel, that we all should be always open-minded, what they feel about all the topics, but particularly for such sensitive topics, because many times we feel that with prejudiced mind, we look at all these scenarios, which we should not be. But listening to the youngsters, teenagers is very important aspect. And I think Dr. Nishikant Kotwal sir will also agree that we should involve uh, on all the forums, we should involve teenagers for all
We
our
have,
activities
we
of
have,
age.
we have an imagination of their word. We
Yes.
must know the actual word.
Yes.
And she's
And
very expressive. I'm
yes.
happy.
And she had focused on four reasons: that absence of proper knowledge and support, absence of emotional support, because broken families or means parenting issues, such girls may fall prey to such situations. Lack of proper sexual education, because our society is such that in India still sexual education word, if we say, many schools will close down, many parents will shut off. So we have converted it into family life education. Then it comes into that trap, they will accept it. And misinformation, that is another problem. So I feel that as a AHA, we should take this responsibility to give our teenagers, to give proper information by various ways. Nishikant Kotwal sir and our entire team had discussed many ways, creating small clips, and I think we should take help of you people who are better than us on social media, okay, to give small messages which are impactful. And community-led and not committee-led advocacy. That word I like very much, because we as a committee of IAP and Adolescent Health Academy, we feel that we should do this, we should do that for teenagers, but we have to learn their aspect and address that aspects. So from today's conversation, I will say that we should take responsibility to give the proper knowledge about such sensitive topics, and youth-led or community-led, particularly teenage-led advocacy should be there. And I will take this opportunity to thank all the office bearers, Dr. Vasant Khadkar sir, Dr. Neelam Mohan, Dr. Sanjay Pakmodi sir, Dr. Amol, Dr. Geeta Patil, all the dignitaries of Central IIP and Maharashtra IIP who had joined for this. And excellent talks by Dr. Hima Bindu, chairperson of CHA, and Dr. Shilpa, and of course, Nimisha, and excellent comments by our own Dr. Nishikant Kotwal sir and Dr. Pragati madam. And all thanks joining all the dignitaries and all the adolescent health lovers, I can say. Okay. And thanks, Sangeeta, for taking the responsibility as a MOC at last moment and keeping up the show in a very beautiful way. Thank you.
Yeah.
Thank you.
Dr.
Can I say
Shailaja,
just thank
Dr. Shailaja madam, I request
Yes,
you
sir.
to declare that we are hosting a first wage zone
Yes,
and
yes.
first
Yes, ma'am.
Maharashtra
Yes,
AHA
yes,
conference
sir.
on
I will declare.
2029. Please
Yes,
declare
right, sir.
that.
I was
Yeah.
overwhelmed with
Ninisha's presentation.
Yeah.
It was
She should
amazing,
also be
amazing.
called
Yeah.
to Pune.
Actually, you know, Ninisha has informed only at 7 a.m. today morning.
Since the
Great,
way
great.
the
7
way
a.m.
they
today
already
morning.
she's doing the work,
And
that's why
yeah.
everything is coming from her heart and everything.
Yes,
She's
Yeah,
by
very
so
heart.
fluent. Yes.
ha.
And she's working in the community. That is
Yes,
the
yes.
point. That's
Good,
why
good.
she was
It
able
is
to do
so.
it.
Shailaja,
Yes, yes.
Shailaja, I had suggested that we should have an open forum in our this conference at Pune.
Yes.
Yes.
Yes,
Because
yes.
I think
Yeah, we are
one thing
planning
that
it.
open forum
Yes,
is
we are
going to
planning
be
already, sir.
We are planning it already, sir. Yeah.
We are
very
already
good.
planning. Right, sir.
So
Jain
we
sir,
have a
thanks a
faculty
lot
now.
for reminding me that. So
Yeah.
on behalf of Maharashtra AHA, I will declare here officially that we have planned now first base zone conference of Adolescent Health Academy and first conference of MAHAAHA, Maharashtra Adolescent Health Academy in Pune at Dr. D.Y. Patil Medical College on 29th June. Okay, so all of you, please mark the date. Dr. Geeta Bansal madam and many stalwarts are here. Please mark that date. And we are having pre-conference workshop, which is the brainchild of Dr. Nishikant Kotwal sir, crash course of adolescent health for medical college students. And we have planned one community program also, but IIP Pune is yet to confirm that. But if they do not take, we'll take it, no problem. So one community program and one pre-conference workshop. And main conference will be on Sunday. And we have planned already youth forum on that, sir. So details will follow soon, but please book the date. Thank you.
Thank you, ma'am.
Can I say
Thank
something?
you.
Yes, please.
Yeah.
Yeah. I just wanted to thank Maharashtra AHA and IAP of Maharashtra, Pankaj, and our Pakmode sir, and of course we have seniors, Rishikant, the whole office bearers, Amol, everybody. I think that's so great. And my own EB, Jayant Pandrikar. One request I made for West Zone, and you and Dr. Shailaja and all of you have marked this as the first West Zone AdolzCon. We are doing this zonal conferences for the first time. Thank you for taking up the responsibility. Let us make adolescent health more visible. Thank you so much. Once again,
yes,
great.
Thank you, Hima.
And
We
all
expect
appreciation
full
to Ninisha.
support.
Thank you. Thank you.
Pandharkar sir is already with us, but we expect the support, and I'm sure that you will give that.
Yeah, actually, please include one youth, discussion.
Yes, yes.
Youth panel we
Supported by
already
UNICEF.
our all
Supported
program
by
is
UNICEF.
ready.
Yes,
yes. Supported by UNICEF. So that will include during the zonal.
Yes,
Thank you.
yes.
Okay, sure, ma'am.
The date is
Date is
29th
29th June.
Amol, 29th June.
Just this thing reminder to you all also that Veg Zone Pedicon of Central IIP is on this. It is also on the same date, 27, 28, 29 of June in
Where?
Surendranagar.
Oh.
No, it is not in the June.
It is
just
in the
sort it out, yeah.
Okay, Dr.
is
Amol,
in
please
the-
just confirm it then, because today only
No,
we will
confirm.
send-
My
Okay.
words are means confirm. Yes.
Then we will just work on it, and
we'll
thanks for
have to
just
change
this
the date now.
information.
No,
We
but
have to change.
okay, we'll go through it. Just
Okay,
find it
okay.
out, some solution.
Okay, sir.
Thank you all. Now this is the time to give vote of thanks. I request our EB member of Maharashtra Adolescent Health Academy, Dr. Vaishali Sirsate madam, to give vote of thanks.
Madam, before that,
Thanks
madam.
all. Yes, ma'am. Yes, sir.
Lot of thanks, madam. It was very informative. All speakers, especially this young girl, Nimisha, she impressed a lot. Wish you all the best, Nimisha. You have a very bright future. Thank you, madam. Thank you.
Thank you, sir. Thank you for your kind words.
Thank you, sir.
Over to Dr. Vaishali.
Yeah, good evening, everyone. I will start from my vote of thanks from the youngest one who has joined. She is none other than Ninisha, and I just googled that what is the meaning of Ninisha, and it was who desires everything with enthusiasm and passion. So that fits her very well, and I'm thankful to Sangeeta madam also introducing her in a nice way. So we should have teenage ambassadors like her in the upcoming webinars as well as in the conference also. I'm thankful to Dr. Shilpa Chirsagar, who is a mother of teen. That was another designation what I found today, and I'm thankful to her for the same. And even I'm thankful to Dr. Hima Bindu Singh, always full of enthusiasm. We have to break the silence and uncover and empower us. So let us join the global call to reduce the teenage pregnancy. I'm also thankful to Dr. Vasan Khalatkar, who is a CIP president, Dr. Geeta Patil, Dr. Geeta Bansal, Dr. Neelam Mohan, Dr. Sanjay Pakmode, Dr. Nishikant Kotwal, Dr. Pragati Khalatkar madam also for her specially able children inputs. And even Dr. Chitra Kulkarni, Dr. Sulbha Pawar, Dr. Shailaja Mane, who is a current chairperson and is president of Maharashtra AHA. And I'm thankful to all the audience and the patient listeners who has been very keen about this particular and very sensitive issue. So I'm thankful to all. And I'm waiting all of you to be join the upcoming first West Zone AHA. So that will be announced recently, but we have to check it, and definitely you will be having this. And please book and block the dates. Thank you very much. Thank you.
Apart from that, just I want to thank Maha IIP also for providing us this Zoom platform, and Miss Pallavi Dharmadhikari, who has taken all the responsibility. And before that, moderator Dr. Tripti Mahatme, who has done lots of efforts for making this webinar successful, but due to some unavoidable circumstances, she was not present today. And Vaikhari also, who was just from the very first day, immediately get ready to just give her talk, but due to some unavoidable circumstances, she was also unable to just attend today, but she has made her replacement with Ninisha, who was also excellent. So thanks to all once again, and just be with us for new programs every month, one webinar from MAHAAHA. Thanks to all.
Sangeeta, I will like to tell all that Dr. Avinash Bansal sir had given one name of movie, Kya Kehna, on teenage pregnancy, which is on practical issues. So Kya Kehna movie dekhna hai hum sab log ko. And he had appreciated the step of AHA to involve adolescent, and he had said that it is felt need assessment is a must. So definitely we are going to involve them, and according to the felt need, we'll catch up at least couple of points and we'll work on them. Yeah. Thank you.
Thanks to Dr. Pragati Khalatkar madam also, because we just want to involve one gynecologist, one pediatrician, and one youth champion, and she get agreed to just chair the session. So thanks to all once again, and see you next.